Hi, my name is Scott Leonard with Philips Healthcare, and we are doing an ultrasound exam of a TCD today. Starting at the transtemporal window, we're going to angle inferiorly looking at the carotid siphon. Flow should be going away from us, and I'm going to go ahead and take a Doppler velocity here. We're at a depth of about 6 centimeters, and taking a Doppler velocity with flow going away from the transducer. As I angle superiorly, I'm going to come up into the middle cerebral artery, and we will look at the middle cerebral artery as well as the anterior cerebral artery. And just angling up in here to the MCA. Beginning at about 5.8 centimeters, we have the middle cerebral artery with flow coming towards us. I'm going to interrogate this area a little deeper, and we want to go down and look at the anterior cerebral artery. Here I am coming in at about 6.2, 6.3 centimeters. I'm beginning to pick up both flow from the anterior cerebral as well as the middle cerebral artery. Anterior cerebral artery is flow going away from the transducer. Just want to interrogate a little bit more and get a little more of the distal ACA. Again, image showing sample volume depth at 6.7 centimeters with peak and end diastolic velocities as well as a time average mean. As we come up and interrogate the MCA, we're going to follow the MCA up. And decreasing our depth as we interrogate the MCA, coming up at around 3 centimeters to the M2 segment. Continue to interrogate the vessel. Going back to our midline structures, I'm going to angle the transducer posteriorly, and we want to pick up the posterior cerebral artery. I'm going to decrease my scale slightly and just change the size of my Doppler box. Sampling at about 5 centimeters. We're going to sample the posterior cerebral artery, both the P1 segment with flow coming towards us, and the P2 segment with flow going away from us. The P2 segment with flow going away from us. At this point, I'm going to have the patient turn on her side, and we are going to change windows. Look through the foramen window, and at this point we're going to evaluate the vertebral arteries and basilar artery. So as we angle up into the foramen. I'm going to turn my color Doppler on, and we can see our vertebral arteries. So pointing out, you can see the foramen magnum here, and our vertebral vessels entering the brain. So at this point, flow is going to be going away from the transducer. And I just wanted to find the basilar artery. I see your vertebrals, I'm not seeing your basilar. So I'm going to sample the patient's vertebral arteries. This is the left artery. And we're beginning at a sample volume depth of about 3.6 centimeters, picking up the vertebral artery and following this distally. As well as sampling the right vertebral artery. And as we get deeper, we'll be coming into the basilar artery. Teresa, I'm not seeing your basilar artery.
Down.
At this point, we're going to have our patient come back on her back, and we will change to an orbital window. We're going to take a look at the ophthalmic artery, and this system does have a preset specifically for orbital imaging. If your system does not, you want to make sure your power levels are decreased. And we will see our orbital artery coming towards us. Can you evaluate our orbital artery? We would continue that entire protocol on the opposite side. And that concludes the exam.